This is Quinn. He is an 87-year-old white male with a diagnosis of dementia and a history of congestive heart failure, hypertension, depression, and gout. He currently lives in a nursing home and has lived there for the past 2 years. And his family consists of his wife Dorothy, who visits 2 times a week, Wednesdays and Fridays. And he also has children and grandchildren, but they only come about once a month. So he has been referred to OT to work on feeding. And one of the questions that it asks is if working on feeding skills will translate over to other occupations. And at this point, it's not really realistic to think that they would translate over. Due to the progression of his dementia, he no longer is able to learn new information. So some interventions that we might, start with would be first to consult with his wife to develop a dining schedule / routine, especially utilizing his wife on the days that she is able to come and visit. And then next, we would want to observe Quinn during mealtime and see what foods and utensils that he has more challenges or success with. And then due to his limited attention, which is about 5 minutes, I'd want to implement some type of cue mechanism, so possibly using cue cards during mealtime. Next, I would develop a list of appropriate foods that the staff could prepare that would, elicit more success, and also that are more appropriate for him to eat with his hands. That way he doesn't have to utilize utensils. So that could mean like hamburgers, sandwiches, finger snacks like, carrots and ranch and that kind of thing. And then also I'd want to utilize weighted utensils. So this could assist him in piercing and scooping up certain foods. And then next, I would want to implement a Dyson mat for his plate, so that way it stays in place, and that way so the plate isn't scooting away from him whenever he is utilizing utensils. And then next, they did suggest that he was having a hard time with drinking, so I would want to implement like a to-go cup type, so that way the straw was held in place and it had a lid, so he wasn't having to bring the cup all the way up to his mouth to drink. He could just utilize the straw the entire time. All right, so next is talking about Quinn's performance patterns. And one of the questions just wants to know how might his wife's roles and routines affect the intervention, and whether or not we would want to include her in intervention sessions. And of course, I think it's super important to encourage family members to be a part of intervention as much as possible. And that way we can establish some type of routine. And then, especially with individuals with dementia, they're more inclined to eat in like a community setting. So having them sit at the table with them while eating a meal themselves would be really an important component, and one that his wife could be a part of. And also, this might make his wife more inclined to visit this facility more than 2 times a week. So, and then I also asked the impact that Quinn's inability to feed himself may have on his wife. One thing I thought of was that she may have a sense of guilt that she placed him in a facility and not, caring for him in their own home. But sometimes, like, when the level of care is just too high and they don't have children close by, it becomes, the level of burden is much higher. And then she also may have a sense of responsibility to come and feed him rather than encouraging him to feed himself. So you really want to make sure that we're working on the self-feeding skills as well. All right, so then it asks about some performance skills that may have a negative impact on self-feeding. So there's some things that he did have trouble with. So lifting was one of them. And within the framework, it says that lifts is the effectively raising or lifts task objects without evidence of increased effort. So he was having a really tough time even, bringing the fork or spoon to his mouth, and ended up dropping all of the food on his shirt and his pants. And so that's definitely negatively impacting him. Also, his attention to tasks with dementia, that just is a steady decline when it comes to that. And then, let's see, handles, so supports or stabilizes tools and materials in appropriate manner, protecting them from being damaged, slipping, moving, and falling. They have an increased rate or amount of dropping things. So he may lose the grasp on the fork or the knife or the spoon, and has trouble with a bunch of different those types of skills. So on the other hand, there are 10 performance skills that are strengths for his ability of self-feeding. So he applies the tools and materials as they are intended. So he is utilizing a spoon and a fork for the proper way of using them. He can bend, and he flexes and rotates his trunk appropriately to grasp or place task objects out of reach. He can also manipulate things without fumbling. And then he responds to and uses touch and bodily contact with a social partner in a manner that is socially appropriate. So one thing that was noted in the case was that his wife comes, and when she comes to help, they hold hands and just form that emotional connection that way, which I think is really important to have the families come in and be there for their loved one. All right, and so Quinn's performance skills. So this is just another picture of him, and I really want to make note, pay close attention to his positioning within the wheelchair. So techniques that I'd want to facilitate to improve self-feeding would be utilization of weighted utensils, the specific cup with a lid and a straw, establishing that routine for mealtime, and developing that specific menu. And so we want to go back and look at what was correct and incorrect about Quinn's wheelchair positioning. So one thing that I did notice was the poor positioning of the trunk and the neck. He's not sitting at a 90-degree angle, and they've elevated the legs, which now hinder him from being able to sit up flush to the dining table. So he has a lot of surface area to cover. So he's having to bend all the way over, bringing the fork full of food all the way up to his mouth, and ends up getting all over his shirt and his pants. So he's not able to feed himself sufficiently, and he can drop his food. So that's no good. Okay, so things that I would do to adjust his chair. So he would be sitting up at a 90-degree angle, but then he starts to slip out of his wheelchair. So it's saying, what would we do? And so I would provide him with a Dyson mat and install a seat belt on his wheelchair. That way he is not sliding. He no longer has to slide out. And then some chair modifications for better seated positioning would be to fit him for a custom cushion, and then bring the chair up to 90 degrees, installing a seat belt, And also looking at different types of trays that we could install onto the wheelchair to serve as a tabletop in case he needs to elevate his legs at certain times. And then some possible complications due to his positioning would be decreased tone, neck and trunk alignment issues, pressure wounds, problems with swallowing and potential for aspiration, poor digestion, increased pain, and inability to engage with those around him.